more than any other, which is troponins T and the beta myosin heavy chain. Those seem to be the most ones. And like some mutations are more, I guess they're more fatal than other mutations, where the other ones are more benign and they don't like cause that much damage to your heart. So these are some of the symptoms. Shortness of breath. It is actually really common, but like the video said, a lot of kids don't like think of it much because they're just like exercising and they're exerting themselves. They're like, oh, it's just a regular thing, whereas it could be that they have this. And what obstruction to outflow of the left ventricle, it just means that when like the left ventricle contracts, it's like difficult for the blood from the left ventricle go to like the aorta. And there's syncopes, which is just fainting. Chest pain, palpitations, abnormal heart rhythms. Arrhythmias also is another one that's like abnormal heart rhythms too. Fatigue, lightheadedness, dizziness, high blood pressure. And normally the first symptom of HCM is sudden death, so that's why it's so bad, I guess. So what happens like when you go to like the doctor, normally they listen to your heart and lungs and they try to see if they can hear a murmur. And if you have if you want to be tested for it, normally you should be tested for it if like your blood relatives have it. So what you should do is, they can like put you on a Holter monitor, which is like a monitor that you have on your on you for 24 to 48 hours, and you're getting like electrode, those patches, and they just like record like their heart rhythms into the monitor, and then like your doctor will check it. There's also a cardiac catheterization. I actually saw this like last week. And what they just do is they insert a long thin tube called a catheter into like your femoral artery by your groin, and then it moves, and then like they push it all the way up into your heart, and like they insert a dye, and that dye shows like what it kind of like highlights your valves and like your chambers, and just shows that. And also they use like X-rays to take the picture so you can see it. I'll show you guys a picture of that. The next thing is an echocardiogram with Doppler ultrasound, and that's just like an ultrasound of like your heart. And this is actually really effective because you actually can see the heart and see it pumping and functioning. And the Doppler, just like, it's like the weather. It shows like the colors, and it shows like the blood flow in there. You can do an EKG. However, like my doctor said that you should probably do it with the echocardiogram, because like the EKG just shows like the electrical impulses of it, whereas the echocardiogram can show like the whole picture, and like the EKG can like miss some of the defects. And I guess you can also use the MRI. I'm not sure how commonly that's used, but that's just like an imaging. So these are the pictures. That over there is the Holter monitor, and you can see those electrodes are attached, and they just like record. That is just a chest X-ray. I don't think I said that, but yeah, that can be used too. This is these two are like the cats. So that's the catheter entering the femoral artery and going into the heart. And that's like the pictures that you'll see from like the X-ray, so you can see like those are like the veins and like the arteries being highlighted from the dye. And that's like an EKG. You can see like the heart's rhythm and like the pulse. And this is the MRI. And this right here is an echocardiogram. It's actually really hard to see. And yesterday, in my clinic, there was like a lady with hypertrophic cardiomyopathy. And like I couldn't really tell the difference, but like the lady who was like doing the cardiogram, she was saying how like the walls are like touching. I don't know what that meant, but I guess it's just, yeah, just information. And normally the interventricular septum, that's like 0.6 centimeters to 1.1 centimeters thick. And the lady yesterday, hers was like 2.3 centimeters thick, and that's like really big. So that's a problem. So when it comes to treatments, there really is no actual cure. You just kind of have to live with it, and make sure like you're tested early for it if like your family has it. And like it's just, the treatment is like the goal, so it doesn't get worse, and it just controls your symptoms. Okay, the most common are medications like beta blockers and calcium channel blockers. They both like reduce how vigorous your heart pumps, so like your heart pumps kind of like in a smoother motion. And this will cause like your heart to be like filled better with blood, and if like your thickened muscle was blocking blood flow, then like your blood flow will like flow out easier. The beta blockers also like decrease your oxygen requirement, and normally patients with hypertrophic have they have like slower heart, so this like helps them improve the filling of the arteries and supply. Verapamil, I believe, is a medication. It's a calcium channel blocker. It improves like relaxation of the muscle, just like what I said before. I'm gonna skip to like the dual chamber pacemaker. That's not really used too often. They use that they tried it in Europe, and like the scientists over there said it like worked well for them. But when they tried it over here, it didn't work too well. So they just don't. I guess they don't really use that very often. But it just can reduce the obstruction to outflow of blood from the ventricle. But one of the main things that they do is surgical myomectomy, and I think I said that right. But they just like remove like that muscle tissue out of your septum, and it promotes like better flow from the LV to the aorta. Sorry. This is also like a treatment. It's for patients who are like at risk for sudden death. It's an ICD or implantable cardiovascular defibrillator. And what it does is like if your heart is like racing or has like an abnormal rhythm, then it like delivers energy or like a shock that's like small but it's like pretty powerful, and it like kind of sets the heart back to its normal rhythm. So that's only used for patients who have like a really high risk of dying. Oh, okay. And I'm just gonna like finish up with some like, I guess, natural history, which is like, this is actually pretty unique because a lot of cardiovascular diseases are in like the older generation of people, whereas cardiomyopathy or hypertrophic can affect like young kids from like almost younger than like age 12 to like older people. So the mortality rate is like 1% per year, and in children it's about 2%. And this is a global disease, so it can affect like literally everyone around the world. However, most cases are from like the U.S., Canada, Israel, Western Europe, and Japan and China. I'm not sure why, but those are just where it's at. And like I said, you can like live with this, it's fine. But like a lot of times it'll get worse if you don't like go to the doctor and see it. And yeah, when also like another treatment, I guess, or something like that, or they'll tell you like not to exercise as much, because if you exert yourself too much, you won't be able to, your heart won't be able to pump as much. So alcohol sometimes is like prohibited because like drinking too much can like trigger irregular heart rhythms like AFib or atrial fibrillation. And I have a little pamphlet on that I'll pass around. And also like weight. If you have like a higher weight, you're at more risk for this disease, and it can also cause stress on your irregular heart rhythms. Oh, okay, it's kind of